Hello YouTube. I have been watching myomectomy surgeries on YouTube, and today I'd like to share with you my myomectomy surgery. This one I am probably the only woman that will actually go into detail about the whole surgery and what you're in for. This is the truth. I wouldn't lie. What happens is, first of all, what you're going to need to do. 4 days before the surgery, you shave your pubic hair. Because if you don't, they will. It don't got to be bald. It's just got to be shaved pretty low. Okay, so that's the first thing you got to do. At least 3-4 days before you have the surgery. It can't be the same day or the day before. It's got to be 3 to 4 days before. That's the way they want it done. Okay, so, what else? Okay, what happens is you go in to the hospital. In my situation, I had a very large intramural fibroid tumor, which means it was inside my uterus. Just like a baby would grow in the uterus, I had a tumor in my uterus, and it was the size of an 8 to 9 month pregnancy. Okay, so it depends on the size of the fibroid, but irregardless, if you're going to have a myomectomy, open stomach myomectomy, this is what you're going to be having done. Okay, so you're going to have these exact things done to you as I had done to me. Okay, first of all, you're going to go in, you're going to sign in at 6 a.m. You're not allowed to eat anything past 12 o'clock. Make sure you are not constipated before you go in. Make sure you're clean. They give you some kind of antibacterial surgical wash to wash with. Make sure you do that before you go in. No makeup, no nail polish, nothing. Make sure your teeth are brushed, you're clean, everything. No deodorant, none of that. Okay? What happens is you go in, you sign in, and then they take you up. They put you in a nightgown. And after they put you in a nightgown, they take your underwear off. They put an IV in your arm, and they give you a Valium to calm your nerves. So after that, they also give you some IV fluids too, and some pain meds. I think they give you morphine on the IV. Okay, so what happens is you're underneath morphine and it's kicking in and everything. They take you back to the surgical room. You're probably waiting in the other room for about an hour. And 30 minutes to an hour, something like that. Then they take you into the surgery room. The first thing they're going to do is make you lay down flat on a surgical table. Okay? And I mean a flat surgical table. You're going to lay on that. When you go in, you're going to see scissors everywhere and different kinds of surgical equipment. But don't pay attention to that. You got to get this surgery done. Okay? So, as soon as you go in, like I said, you lay on the table, and the anesthesiologist is going to pop a mask on your face immediately. You will be out within 3 seconds. You'll go 1, 2, 3. You're knocked out for at least an hour or so, or 2 hours. So while you're knocked out, you don't feel anything, okay? You don't feel nothing. They open your stomach up. They cut it like a bikini line. After that, they open it up, you know, until they get to the uterus with an intramural fibroid. After that, they cut either, I think they cut it vertically. Yeah, since they cut you horizontally, bikini cut, then they cut your uterus vertically. And after that, they open it like a peach. They open your uterus up like a peach. And there's a big old tumor in there. It's like a pit inside a peach. Okay? But mine was huge, like a melon. So my pit was the size of a melon, my fibroid. So basically they go in, they, you know, cut the tumor out of the uterus and peel it like a peach, and then remove it. They burn it off and then peel it like a peach, get the tumor out. When they're done, they sew it back up. And then after they're done sewing it back up, then they sew your stomach back up. okay, to where you're going to have a bikini scar horizontally where your bikini line is. Also, after that, you're going to wake up a little bit. They're only going to wake you up a little bit, and they're going to move you, make you get up off the surgical table into a regular transportable bed. When they transport you to in the transportable bed, they transfer you to the recovery room. Well, okay, and then you're just sleeping until you get in the recovery room. And then when you wake up, you got oxygen tubes up your nose. So you're going to wake up with oxygen tubes up your nose. With no oxygen tube in your mouth, though. Unless you had a complication. After that, they make sure you're okay, you're alive, you're breathing, you know, you're aware of your surroundings, but you're groggy. You're very, very groggy. So you don't remember too much. You don't remember that much. You just remember bits and pieces. And then they take you to your bedroom, your maternity room, pretty much. And you sleep in a nice, comfortable maternity bed that goes up and down, up and down. You can move the legs, you can move the arms, you can move the back of the bed. Then in the room, usually they also have a like a recliner chair for like maybe a friend that wants to come stay the night with you. They'll sleep in the recliner chair beside the bed. It's just like having a baby pretty much, but worse. It's just like a C-section, but worse, because it hurts worse and stuff like that. But it's very similar pain. Anyways, after that, they're going to give you an IV. You're going to have an IV either in your left or right arm, usually your main artery, like right there. Like with me, that's where I got mine done. And they pump you with morphine, and they give you a little pump button. Okay, it hurts so freaking bad when you wake up. You're like, I feel like I'm going to die. It hurts so bad. Being honest with you, it freaking hurts. And the nurse says, pump that button. So you get your little button, I had a green button. So I pushed my button, and then the pain would go away. Then after the pain would kick back in, I go, ah, it hurts. And they said, pump that button. I pumped the button again, and then the pain would go away. And then as soon as the pain came back, I'd be, ah, pump that button. I'd pump the button again. So you'd have to do that the whole 24 hours. That's the worst time. It's the first 24 hours, okay? So you're not going to want to move that much the first 24 hours. You're not going to want to twist and turn in a bed, nothing. After that, you basically, your stomach hurts like crazy. And from the general anesthesia, your lungs get like fluid in the lungs because of the general anesthesia. You're going to have to cough that up. Yeah, you're going to have to cough it up after you have the stitches put inside the uterus and outside of your skin. So you don't want to cough on your own. You're going to have to call the nurse in, okay? And the nurse is going to put a pillow over top of your stomach, a big thick pillow. She's going to push pressure, hard pressure on your stomach, or firm pressure on your stomach. And you got to be bound and determined to cough that fluid up, okay? And it's a lot of fluid you got to cough up. You better hope you get it all out in one go, because if you don't, you're going to cough and cough and cough. And it could bust your stitches internally and externally. And you could be in a world of trouble, because it could bust your surgery up and you could have internal bleeding. So make sure that you have the nurse do not cough on your own. Get the nurse to put a tight, like I said, pillow, like she did me. She put a pillow over my stomach, and I said, I'm going to do it, nurse. Hold it tight, nurse. I'm fixing to do it. I've got to get this fluid out of my lungs, nurse. Hold it tight. I'm fixing to do it. And I held it for a good 24 hours, and after like the 26th hour, I said, nurse, I've got to cough this up. So finally, I got enough bound and determination to cough it up. I said, hold it. She held it, and I went, like that, and I coughed up a lot of fluid, and she was amazed that I didn't have to cough more than once, because I did not want to bust my surgery up, and it hurt like crazy. Okay, so you have to make sure the nurse does that. After that's over with, you got your lungs cleared, so that's good. And then you just continue to lay in your bed for the next 48 hours. Don't move. You know, you don't turn over or nothing for 48 hours, which is 2 days. And then you got the hard part done. You know, the first 24 hours is the worst. Coughing up the fluid is very bad because it hurts your stomach like crazy, but you have to do it. Then on like after 48 hours, you could start twisting and turning in the bed. Turn on your side, rest on your side, rest on your side. After the 3rd day, they make you get up out of the bed. Okay, and it hurts like crazy. So you got to get the nurse to help you up out of the bed. Once the nurse has helped you up out of the bed and you learn to walk again and learn to deal with the pain, you're fine. You can walk, but don't walk that much. Just walk around the halls maybe 3 times, you know, a day that you're in there. After that, after the 3rd day, you're allowed to take a shower. You just got to keep your stitches covered up so they don't get wet. I had dissolvable stitches. And it worked great. Okay, you could hardly even see my scar. The recovery, after about a week, you will start feeling better. But on the way home from the hospital, after like the 3rd day, they release you, 3rd or 4th day, they release you. And oh my gosh, on your way home, you're going to feel every single bump in the road. It hurts so bad. You're going to feel every single bump in the road. You're going to go, ow, 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 until you're home. When you're home, you go up your stairs and you get in your bed and they give you your painkillers, usually oxycodone or something like that is usually what they give you, or morphine, some kind of pain medication. Make sure you take it. And you're not going to, when you sleep in your bed, you're not going to want to get up to go pee-pee. Because it hurts bad to get up. That's the worst part, is like getting up. It hurts for a good, I'd say 2 weeks. It hurts just getting up out of the bed to go pee. So I advise you to get some Depends. I peed myself once because I didn't want to get up. Because it hurt too bad. I didn't feel like getting up. I wanted to sleep. So I put on some Depends and peed in a diaper. So get on some disposable Depends, you know, just in case. Take your pain medications. Do not lift anything heavy. Do not hurt yourself. Do not exercise for 6 weeks. You're going to be swelled up for about 2 to 3 months. I'm sorry I'm jiggling, but my foot is asleep. So about 3 months, you're going to feel like the tumor's still there, but it's not. It just takes 3 months. It takes 3 months for the swelling to go completely down. After that, you're fine. But you can't get pregnant. You have like a very lesser chance of getting pregnant. If you don't have a myomectomy, you have about a 90% chance of getting pregnant. When you have a myomectomy, it may, you know, it scars your uterus and stuff. So you have probably a 25% chance of getting pregnant. But that's the truth of how the myomectomy surgery works. I had it, and I told you in all detail how it's done. So be prepared for all that. If I can do it, you can do it. It's worth it. If you want to have children, but me, I can't have none. But hey, at least I got that tumor out. It was 10 pounds. It was the size of a 10-pound baby. Sure is. Would you like to see my scar? I don't think you do. My doctor did pretty good. She didn't leave too much of a scar. She did great. I mean, like, you can't even hardly see my C-section scar. So I just thought I'd let you guys know about my myomectomy surgery, and if you're going to get one done, what to expect. I told you everything in detail on what to expect. Do not be scared. You won't feel a bit of pain under the general anesthesia. They simply pop a mask on your face. You're out in 3 seconds. Literally. Because when I went and got mine done, I went in there and I thought they were popping an oxygen mask on my face. And I said, when are they going to give me the general anesthesia? And I asked him, he just popped the thing on my face. I thought I was inhaling oxygen. But it wasn't oxygen, it was general anesthesia, and he didn't even answer my question. I passed out so fast. He didn't even answer my question. And they also put a cap on your head, too, to keep the hair out of the way. So you will have to wear a cap into surgery, as well as the doctors, too. So I just thought I'd let you guys know that. Oh, yeah, and don't forget the catheter. They do put a catheter in your pee hole.